Let's welcome my next guest, Fox News foreign policy contributor and former State Department official Kiron Skinner. Great to see you, Kiron. Your reaction to these developments?
It shows the global effects of what the Chinese government under President Xi has allowed to put forth. If back in December 2019, when the first symptoms arose in a region of China, the Chinese government had been transparent, had worked with the public to contain the crisis, perhaps we would not see more than 60 countries around the world with coronavirus infections. We would not see the sheer number of people around the globe who have it. Both coasts in the United States and places in between, we now have cases of coronavirus. Perhaps this would not have happened the way that it is moving. And we have a lot to contain. There's still a lot we don't know. The Chinese government has not given the kind of information that most nations need to control this virus. So this is a case example number one of the global effects of an authoritarian regime that is not working with the international system in a way that a representative government would.
Kiron, this has been a problem for decades. The bird flu of 1997, SARS, the outbreak in that, swine flu, MERS. China has been at the epicenter of major viruses. And this coronavirus may have been circulating undetected for the past 6 weeks in Washington state because it's potential for mild or even asymptomatic cases. Do you think China should step up and start apologizing?
I think it's more than apologizing at this point because there's loss of life, and I don't know how much that will do for those who are suffering the ultimate sacrifice in this case. But I do think we have to worry about those countries like Iran also, that is one of the countries that has many cases of coronavirus, about the way that they function and the lack of transparency and the lack of engagement with the international community, including NGOs and other international organizations, their inability to support international norms during a time of crisis. The United States and the free world are really up against a condition that could affect so many more people, and we're trying to contain it. But we've got to be able to work across borders, because you can't control borders in this way. While President Trump has declared that the nation state is the core unit of analysis in the international system, we are also seeing that there are times when you can't control the political and territorial borders of a state. And this virus is one example. We need to be able to hold hands with other leaders and healthcare workers around the world. And that's where we're seeing the Chinese not being the most responsible partner.
It's like, enough already, China, right? I mean, countries need to stand up and say, literally, what you're doing is killing us. What's going on with your viruses have been going on for decades. Again, H1N1 through to now. I mean, we know that the president met with the big drug makers today, including Pfizer, Johnson & Johnson. We also have Gallup, a surprise poll result coming out of Gallup, Kiron. For the first time in 2 decades, U.S. voters now see that the United States is the leading economic power, not China. Let's listen to the president in talking with the world's leading drug makers. Watch this.
We have the ability to produce large amounts of vaccine. We predict, depending upon the final formulation, 100 to 600 million doses per year.
When do you think you could have the vaccine?
We think we could be ready for the clinic in a year.
We anticipate, if all goes well, 200,000 doses per month can come out of our factory in New York starting in August.
That means you'd be able to use the vaccine that early?
Depends on what we see, how we work closely with the FDA, which we will do.
All right, the president is trying to move fast on this. The vaccine may be months and months away. We have some slight good news coming out of China. They shut one of their rapidly built hospitals, saying that now the cases there seem to be dropping. But do you see what happens here? The president has to sit down with drug makers to stop what happened in China.
Absolutely. And, listening to that conversation just really kind of lightens my heart because we have amazing medical experts in the United States. And when they are unleashed on a problem, combined with our excellent science and technology backed up by the U.S. government, you get outcomes that you don't see anywhere else in the world. But there are other countries like Singapore who, have worked hard to contain this condition and have advanced testing techniques. My younger sister is a trauma surgeon in Northern California, and she said there's a lot of panic, but there's also a lot of calm because there's just a sense that we know what we're doing. We faced challenges like this before, and we come together as a nation. And I believe that's what's happening actually right now.
Yeah, you feel bad for the health workers on the front line of this. I mean, they're really exposed. Kiron, great to see you. Come back soon.